We were happy to present for the first time the results of the RELEVANCE study. Just a little bit of background, you know that our chemo followed by maintenance is the standard treatment for follicular lymphoma in need of therapy. And we also know that lenalidomide is able to restore T cell and NK cell function and was shown to be synergistic to rituximab with very high CR/CRu rates in phase 2 study. So the purpose of this large randomized phase 3 study was to compare our chemo to R square. We set up this big trial in collaboration with Celgene and LYSA, the Lymphoma Study Association from our group in France, which were both sponsored. And we managed to recruit 1,030 patients between December 2011 and November 2014. All those patients were in need of therapy according to GALF criteria and were randomized to either R square or R chemo. R square, the lenalidomide was given over 18 months with an additional month of rituximab maintenance. In the R chemo arm, the choice of chemo was done per patients according to the investigator, pre-randomizations, and the choice was between R chemo, R-banda, and R CVP. So there were two co-primary endpoints, the CR/CRu at 120 weeks, which was considered as a surrogate of PFS, and the interim PFS, since at this first report we had 50% of events. What we could show is that the CR/CRu rate was similar, 48% for patients with R square versus 53% for patients with R chemo. And the median, the interim PFS, so at 3 years, was exactly the same, 77% for R square versus 78% for R chemo. So pretty much similar results in terms of efficacy. What was also interesting is that we had a different safety profile, and what really stands out was that we had more grade 3 for neutropenia, more febrile neutropenia, 7% versus 2%, a higher use of growth factors in R chemo. And on the contrary, in the R square arm, we had more skin toxicity, more tumor flare, and a little bit more diarrhea. The next analysis will be done when there will be 70% of the events, and we think it will be maybe in 2 or 3 years. And probably the final analysis was planned in 2024, but the next analysis will be key to see if we can confirm those results and if there is any difference in terms of overall survival, because at present it is too immature.